Good morning or afternoon, depending on where you are. Welcome to our webinar today. I'm Dr. Gordon Barfield. I'm a career dentist and orthodontist and a member of the clinical team here at Overjet, the world's leader in dental AI. We are very fortunate today to have two amazing leaders from Affinity Dental Management, who I have had the pleasure of knowing for a good while now. And they're going to share how both clinical leadership and operational teams can use Overjet's clinical intelligence platform and DSO analytics data to drive measurable business growth. We're joined first by Dr. Mariz Tanious, who is the Chief Dental Officer at Affinity, as well as Margie Dorsa, who's a regional manager at Affinity Dental Management. Welcome to both you guys. And again, thank you so much for joining us and for donating your time for our audience to learn about how you guys action upon this data that's being created by artificial intelligence. As I mentioned before, we've known each other for a while, and we share a common passion for the things that data can do to improve clinical outcomes, and that's really what this is all about. I'm always impressed with how excited you both get when we're talking about data-driven insights, and I really love your passion. So I'm excited for the audience to hear from you today on these topics.
Thank you for having us.
You bet. Margie, I'll start out with you. From the operations perspective, how do you actually use Overjet's analytics tool in your weekly or monthly work with the offices? What's the biggest operational impact that you see this tool and the data that flows from it having?
Sure. It's actually the daily, day-to-day operational tasks that we've really been able to have the team focus on. And this really highlights that for them. So it's no matter how busy the office is, they're able to really dive into each patient that's in front of them and utilize the information. So for example, on here, when we pull it up, we actually print out based on the providers every single day. So they have like a little action tab. Any documentation that might be missing, any documentation that's necessary in order to properly diagnose the patient, for example, perio charting, additional bite wings, any radiographs. We're able to capture that before the doctor goes in to do their final assessment. It also alerts the team any potential concerns for the clinician to review, caries detection, PLR, anything like that with bone changes. We're able to identify that and then have the team focus and present treatment plans for patient acceptance. It's also been crucial with having patients see and identify what the providers are talking about without just having an image of an x-ray. They're able to see in color what these providers are explaining to them so that it can help educate them for their treatment.
For sure, I love that. And we talk about spotting care opportunities. That's a common theme here, right? One of the beauties about artificial intelligence is it does a really great job of spotting opportunities for care that we as, frail human beings with some weaknesses might well miss. We all miss things, right? Can you share an example of how the analytics themselves help you identify an opportunity, maybe at one of your locations, and then ultimately what prompted you to act upon it or how you acted upon that opportunity?
Absolutely. So on this slide, it shows potential for periodontal conditions and periodontal charting that is required because it's identifying discrepancies in the bone levels. So this helps us with our hygienists and our clinicians to go ahead and get that documentation. And then once we have it, they can reaffirm that, yes, the person either needs scaling and root planing, see the periodontist, additional treatment, and we can go ahead and either send out for pre-authorizations or get those patients alerted and scheduled for that treatment.
Beautiful. So having information right at hand that we have not had before this type of tooling, allowing us in real time to have this data to be able to take action upon it. Whereas before we may have intuitively known some of these things and some of them we may have not. Is that kind of the way it goes?
100%. And somebody can look at x-ray and say, oh, they're good, the inflammation. But when you get the numbers and you're getting that, that actually helps them to provide treatment. The other aspect is with the caries detection, we've noticed an uptick in our provider in one of the locations where he has been able to identify those missed opportunities and providing the care that the patient needs, just because, it could have been, oh, let me watch that next time. And this is saying, this is really something that needs to be addressed. And he can either get another radiograph, see it from a different angle, or just confirm that, what, this is something we need to address now and not wait on.
Yeah, got it. You guys make such a wonderful team. I always enjoy working with the both of you so much because your alignment and your synergy around these concepts are so wonderful and ultimately leading to better patient care because that's what this is about. Dr. T, I just want to ask the question. You talk about how analytics helps you answer this core clinical leadership question. In other words, why is this happening? But I know the audience wants to know about kind of the nuts and bolts of how this happens. How do we go from a simple chart or a data visualization to an action, a clinical action, which leads to an increased treatment plan and hopefully increased case acceptance? What's the bottom line here?
The bottom line is really taking all this analytics that we get and turning it into actionable data. And I know we talk about that all the time, but I do want to go back to the one slide before that I wanted to just add, when Margie's team is looking at the analytics from this page, they are filtering and I want to point this out because this is very important. They filter the day before and the day after. They look at the day before for missed opportunities at the end of the day that the clinician might have missed. And then they also look a day ahead to prepare for the following day where they can review with the provider. They take this information to the provider and they say, hey, can you take a look at these findings? Do you agree with these findings? And if so, we could maybe start pre-authorizations ahead of time. Or, hey, did you miss anything? Like Overjet's mentioning something. Do you agree or disagree with these findings? So that really helps drive the provider in this particular office to be successful and to make sure that our patients are receiving the best quality care. Now, if we go to the next slide, which focuses on, furthering that, what I'd like to show you here on this slide is, the last 2 years before, not counting 2025, this provider already had a higher treatment planning rate than, maybe other providers within our company. And this is specifically for crowns. And the reason why I'm focusing on crowns is because this year we focused on a cohort of putting our doctors in groups and trying to bring up those treatment planning rates by focusing on one particular data point. Overjet is wonderful with providing so much information, but for doctors, at the office level, that could be very overwhelming. So I wanted them to get it in bite-sized forms. So if we're looking just at crowns, we're looking at this provider and, again, in 2024, and I would say this is a higher treatment planning rate than I would have expected, but it's because his team was already on board with that prior process that we spoke about. Now, if we move in, and by the way, you could, with this dashboard, I mean, I'm looking at this dashboard every day. I'm filtering for providers. I'm filtering for different recommendations. I'm looking at, appointment dates. I'm looking at prior dates. I'm looking ahead, a week ahead, and looking at what opportunities are coming in or what have we been missing. And that way it helps me pinpoint not just provider, but office or region and say, okay, maybe this region needs additional help, or maybe this office needs additional help. So from that aspect, I'd like to move to the next slide and show you year to date. We've seen in this provider an additional 10% increase in his treatment planning for crowns. And that's because we focus more on the doctors this year. So if his team has already been on board and now the doctor's on board, you see that 46%. I mean, that's pretty great from where we were before. And even when you look at trends. We're very big on trends and looking at, okay, an average is an average, but is the doctor improving over time? And that's really what we care about because they could have had a high average and then they're falling down, right? They're falling off the cliff, and we don't want them to fall off the cliff. We want them to continue to be successful. And what I've learned is that doctors are successful. They are identifying, but they might not be treatment planning it in an actual formal documentation of a treatment plan. So after having my conversations with all the providers, they tend to understand, oh, okay, I can't just put it in a progress note. I have to actually, again, be actionable about it. You have to document it in a treatment plan. And case acceptance is a whole different beast, which we're not going to talk about today because there's so many variables. But, you know, increasing your treatment planning rate takes a lot of doctor work, but also the team has to be involved to really truly be successful. Sorry, that was a long-winded answer.
No, it's a wonderful answer. And you actually answered my next question, which was about clinical behaviors or workflow changes that contribute to that change. That's amazing. Can you share an example of where perhaps the drill down capabilities in the data platform help you to identify some of these care opportunities that otherwise might have been missed, and what that kind of means when you look at it from an organizational perspective?
So, before I get into that, because I did want to share one more slide. If you could go to the next slide, Abby, thank you. I just wanted to share this doctor's trend. We started off back last year at 14% treatment planning rate crowns. Now, our goal for this year was 30%, because again, you give the doctors in bite-sized pieces of information that they can not be overwhelmed with. And so, as you see, when we started this cohort with me meeting with this team, with my team every month, you see an upward trend in this graph. And then it was stable for a little bit, right? This doctor was getting over 40%. That's wonderful. There's some dips. Obviously, there's seasonal changes in dentistry. And unfortunately, not every patient, comes in or whatever it is. But as you can see, there's a huge dip in August, and that's because he actually was on leave for a little bit. And we started to ramp him up once he came back. And as you can see, in January, he went, sorry, not January, November, 26% treatment planning rate was climbing. And we are still obviously not done with the end of the year. So there's more room for growth there. But, he was at a pretty steady 40% rate, which shows that he was, proof of concept, right? Like you spend time with your doctor, you create the processes, they end up, improving their performance. Now, if you go to the next slide, I want to talk about how we drill down to actionable data. And what does that look like? One thing I'd like to say is all the doctors in every office have access to the analytic platform. They can look at their own data on a daily basis. I give them, free will to do that. They can see other doctors in their clinics. They just can't see the entire company. But I think it's very important to be transparent about the numbers and where they're at. That helps, either motivate them or maybe it doesn't motivate them, but I find ways to help them understand it from a positive perspective that there is room for growth. And hey, you're already doing it, you just have to document it. So if we're drilling down to the actionable data, we usually scroll down to the recommendation performance. That table there, if you click on it, it'll go to the next slide and it'll show you where I truly value this dashboard. It helps us see all the patients coming in after obviously we have filtered for what we want. Typically, I filter for everything that's not treatment plan. So that's all the false findings. And then I look at all the links to the right here. The links show us exactly which tooth or, radiograph Overjet is identifying. So when we click on that, it takes us to radiographs that Overjet has identified. So that to me is very important because the doctor isn't, having to do so many different tasks. They're actually able to just click within Overjet to take them to that data point, that radiograph that's telling them there's something there. I also use this to look at, when are patients coming back, right? When are they coming back in a day or two? Are they coming back in 6 months? If we're looking at their next appointment day and this patient definitely needs to come in for that particular treatment, we're able to reappoint them. And that then goes back to the operational team. So what I like to do so that everyone has the same snapshot that I'm looking at is I actually export this into an Excel document, which is doable here, through this platform. And when I have this particular Excel spreadsheet, I send it to the manager, to the regional, and to the doctor. And I say, hey guys, this is the opportunity that we have. Please double check. Again, there's going to be false positives. And those false positives are generally things that are caused from overlap, or maybe it's an abfraction lesion. And again, Overjet only looks at what it's actually reading is different shades of gray, and when you understand that, you're using it as a tool to help you. So taking that data, the doctors and the managers work together to help improve their overall performance. And then at the end of the day, patients are receiving the care that they deserve and need.
Yeah, I love that. And that goes right to sort of what I'm thinking about next is clinical and operational alignment, right? You guys are looking at the same piece of data, right? But from two different lenses, from two different angles, if you will. How do those two perspectives kind of come together and merge to be able to drive change across the organization? Because at the end of the day, what we're trying to do is drive change, right? We just do it differently.
Correct. We're driving change from a behavioral standpoint, right? But we need to have an action plan. So the action plan typically is, involving our, executive team, and everyone has to be aligned with that. Once we are in alignment, then we can drill down to, the regionals, to the office managers, to the doctors at the clinical level. And when we do that, you have to have training. So there's a lot of training involved. There's a lot of, continuous training. It's not a one and done kind of thing. And I think that's what people don't understand is continuous training is very important. So, every week, I meet with some of the doctors every week. And then for this cohort monthly, I show them this data and I say, hey guys, these are your patients. Let's see what we missed and why did we miss it? Tell me, like, walk me through. Was it that it looked like it was there, but it wasn't there? I like to, um, these are not my ideas. I didn't make up rules in dentistry. I follow the rules from different organizations like the American College of Prosthodontics, right? This is one of the associations that I love to follow because they kind of set the standards for us. They have certain guidelines. They have position papers, and when you look at their position paper on, crowns or fixed prosthodontics, you look at, there's no true acceptable measure, you could say, for an open margin. But we can say that, they have a guideline that says, 6 to 120 microns is acceptable. Well, what does that actually mean? Can you see, on the higher end, 120 microns is actually like not visible to the eye or not really visible on radiographs. So if that is the acceptable range and it's not visible on a radiograph, when I see something that's visible, like on the next slide, then I say, yeah, we should be treating that, right? Or like, this is not about open margins. This is about decay here. But, on maybe go to the next two slides. Maybe these slides should have been rearranged, but one more slide. So number 18, for example, it's visibly there. It's a short margin. It's not really an optimal a crown that I would have liked to see in someone's mouth. So Overjet identified that, right? They said, look here. And I'm looking and I'm like, I could see with my naked eye already. But when Overjet tells you, and it's this big blob of red, if you want to go to the next slide, that should alert you. That should say, hey, okay, I need to look at this, right? And then you should talk to the patient about it, and from there, treatment plan it. If the patient disagrees, then that's fine. You could bring it up at the next visit and the next visit after that. But we have to follow the standards, which tells us, you know, this is not an acceptable crown. If you could really see it, and we know that, open margins can cause decay underneath the crown, why would we subject our patients to that and not be actionable about it?
Yeah, 100%. And Margie, I'm curious from the operational side of things, a similar question. How do you interact with the teams to drive these initiatives forward? Obviously, Dr. T is spending more time with the professional staff than with the core team. How about your interaction with the support teams and how does that look?
Sure. So the support teams, they're gaining that documentation that could be missed, and anything that is identified, like we're checking it the day after to see if there's anything and bringing
Mhm.
it to the clinicians for them to review and say, yes, I agree with this, or no, I don't agree with these findings. And once we do that, if need be, we get in touch with the patients, get them in either for an additional radiograph to tell them, we use a tool that helps the providers look at your mouth in a different way, and we able to get that information for their treatments and get them back in and get them scheduled. Like Dr. Tanious said, if they're booked 6 months in advance, we don't want this decay to get worse and then it's an issue 6 months later. So we contact them immediately, get them in, or if it's something that's identified, we already addressed it with the patient, we send out for pre-authorizations and get them back in as soon as possible. And it
Yeah.
also helps as far as on another side, when we're trying to get those pre-authorizations, if anything comes back, we're able to use this documentation because a lot of the insurances are using AI also, and it allows us to get better approvals.
Is there a point at which this data and the information that's available helps us align the professional team with the support team? I'm always curious about that because, in the most successful dental practices, the teams are the best aligned typically, right? Tell me about y'all's experience in that.
Absolutely. It brings the teams together because, you have the front of the house and you have the back of the house, and usually it's like the admin and the clinical staff. But when we're all together doing a common good for the patients and making sure that their care is getting taken care of, they're all part of the same team. So the admin people feel like they are part of that clinical staff, even though they're not clinicians and they can't diagnose, they're able to help support the doctor and bring it to their attention if it happened to be missed.
Yeah. And same question for you, Dr. T, from the other side of things. I've been around this long enough to know that there is occasionally this underlying friction between professional clinicians and their support staff. And how do we minimize that? How do we use data to actually do that? And where are you guys finding that success part?
I mean, we find it, again, I think I may have mentioned this, but when we come together as an office and we're using the same programs and everyone's on, understanding how those programs work, then that's really where we find the success. And our patients see that as well. When a hygienist is using this to prepare the patient for when the doctor comes in to say the same exact thing. And then, from there, the patient's like, oh, well, the hygienist says it and the doctor is saying it. And then the treatment coordinator comes in and says, the doctor says you need this crown. The patient then automatically will say yes. Most of the time. I don't want to say automatically, but like, most of the time they'll say yes because they see the urgency from the entire staff. There are people out there that might say, oh, you don't really need this now. We can wait 6 months, or we could do this, in the new year when your insurance renews or whatever. I don't see that as beneficial. I see it as the entire group has to have an urgency for why we do what we do. And if they don't, and they're not aligned, and they're not using Overjet, and they're not, getting their pre-auths early, and they're not, then it kind of falls apart. And that's where you see stagnant numbers. There are offices where some providers just don't want to use it, and I know that's the case for a lot of different companies, right? Not just for Overjet, but any AI company. And I think that it's about how you present it and how you manage your doctor's expectations from when you onboard them. And again, I'll talk about this at the end with my key takeaways, but really, when you have the entire uh, office on board, you just find that they grow and it's incremental, but it shows at the end of the year. So, and there's proof in the concept that we have right here.
Yeah, that's absolutely spot on. I think it's oftentimes human change management is our biggest challenge here, and now data points being able to help us in that process doesn't solve everything, but certainly helps us through that. As we kind of close out into to get those key takeaways from you, Dr. T and Margie, based upon your experience at Affinity, what kinds of pieces of advice would you give to other DSOs or orgs or even practices thinking about adopting AI and specifically the analytics that are produced by artificial intelligence to help improve clinical quality and then ultimately business outcomes that come along with better clinical performance?
Margie, I'll let you take that one first.
Sure. So I would say that the daily consistent processes help for the successes of the entire team. So if we're just doing this on a daily and we're consistent with the processes and we're identifying and bringing it to everybody's attention, it works. I just want to piggyback to what Dr. Tanious said as far as presenting it to the patients with treatment plans. The addition to Overjet doing that presentation mode has been very critical in where patients are like, I'll just wait, I'll just wait, I'll just wait, because now we're able to show them a sequence of the different teeth and say, okay, well, number 3, we waited, here's all your progression x-rays, and it actually shows it advancing, and it's helped to have patients kind of commit to treatment that they were hesitant on.
Yeah.
For the audience, what Margie's referring to is one of the modules within Overjet where you're able to compare images throughout time. In other words, a T1, T2, T3 time comparison and ultimately show disease change over time. Go ahead, Dr. T. Sorry, I didn't mean to step on you.
No. I was just gonna say, I mean, and that's also a great tool. I mean, that's the presentation mode is wonderful for patients, but also for doctors and showing, oh, you disagree with this. Well, let's see what happened 6 months later when you disagreed with it. They see that disease progression and that, it gives them a little bit more faith in, the AI, right? Like that it is accurate. But it is a teaching tool as well. When is it that you actually start treating incipient decay, right? I mean, obviously it's incipient, but there's sometimes where incipient decay may have also broken through the enamel, and is that when you treat it, right? I mean, there's obviously certain guidelines for that as well, but it's surprising to understand different doctors' philosophies. Everyone was taught differently, and then over time, when you're in practice, your philosophy changes. And so when there's someone like me who brings it up and asks the questions to the doctors, it's not to make them feel bad or really it's more to challenge them and to make them better because all I care about is, making them better. And then at the end of the day, our patients get better care. So, it's a wonderful tool. I can't live without this. So,
And it's great for the admin because we're not clinicians, but it's identifying it through the AI, and all we're doing is showing them what had been on the screen. So it helps with that conversation.
that's
This
correct.
is amazing. And just like always, when I talk with you guys, I get a key takeaway and I learn more than I thought that I would learn. This has been amazing. I hope it has for the audience as well. I want to thank both of you guys for being with us and donating your time to this discussion. We want this to be meaningful for the clinicians, for the profession out there. So thank you all very, very much again for your time. And I think we've got a quick poll. If anyone in the audience needs more information about Overjet Dental AI itself, please feel free to click on the poll, and we'll get to you, contact you with your inquiry. So again, Margie and Dr. T, thank you so much. Hope you all have a wonderful, wonderful day and the rest of the week, and of course for the holidays.
Thank you so much,
Thank you.
Dr. Gordon. Take care. Thank you, Abby.